Hello, good afternoon, colleagues, or good morning, depending on where you are. I would imagine that for many of you in the Southeast Asian region, it will be good evening already. And welcome to this FIP webinar on empowering pharmacists to support tobacco cessation in the Southeast Asian region. My name is Gonzalo Souza Pinto. I'm the lead for practice transformation at FIP, the International Pharmaceutical Federation, and I'll be today's moderator of this event today. Unfortunately, Dr. TV Narayana, who is the president of the FIP Southeast Asian Pharmaceutical Forum, could not join us today for reasons beyond his control, and therefore I will be moderating today's event. Next slide, please. Just to start with some house rules in terms of the webinars. As you know, this webinar is being live streamed on YouTube as well, and it's also being recorded. So you may also revisit the webinar if you want to listen to it again, or you may share the recording with your colleagues if you find this webinar interesting. So the recording will be available as well as the recording of all FIP webinars. There's a large library of recordings at www.events.fip.org. In terms of your interactions with the speakers and the panel, we appreciate if you use the Q&A tool, the Q&A box, to address any questions to the panel in general or to a specific panelist. Please state your name and your country and your question. And use the chat function for just interactions with others, participants or in general. And you're also welcome to send us any feedback if you wish about this webinar and in general about FIP webinars to webinars@fip.org. And finally, we do invite you to become an individual member of FIP and consider all the benefits that you may access as being a member of this large global family of pharmacists. And next slide, please. So we have a wonderful panel today of speakers from across the region. We have Dr. Jadish Kaur, from a regional advisor from the Tobacco Free Initiative of the WHO Regional Office for Southeast Asia. And then we have panelists from Sri Lanka, Dr. Vindya Pathiraja, from Indonesia, Audrey Clarissa, and also from Thailand, Professor Virat Tongrod. I will introduce each of the speakers before their presentation and let you know a little bit more about their CV as well. So next slide. So for today's program, we will start with a brief introduction, and then Dr. Carr from WHO will provide an overview of the burden of tobacco use across the region, but also what are the policies that are in place to curb the use of tobacco and the services that are in place by healthcare professionals to support people quitting tobacco use. And then we will have the three presentations describing experiences of how pharmacists have led services and provided services to the community to support tobacco cessation in Sri Lanka, in Thailand, and also in Indonesia. And finally, we will have who is the Practice Development and Transformation Projects Manager and works closely with me. Ines will be providing an overview of the resources that FIP has been developing in recent times to support the pharmacists in tobacco cessation, and also some policy documents that we have for our member organizations. And then we will have if you have any questions in relation to the presentation by the different speakers, please do not hesitate to use the Q&A tool to send them. Thank you very much. Next slide. So the learning objectives for today's event, we hope that by the end of this event, you will learn about the burden of tobacco to the Asian region, and also understand the importance of leveraging pharmacists to provide tobacco cessation services, to diversify the range of professionals that offer accessibility of pharmacists of services provided by pharmacists in tobacco cessation in 3 countries, and share with you, and you will learn about the resources that can support you in this role. So it is now my great honor to introduce Dr. Jagdish Kaur, Tobacco Free Initiative at the Southeast Asian Regional Office of Health Organization. We truly appreciate that Dr. Kaur is joining us to have the WHO at this event. So thank you very much for your participation, Dr. Kaur. Dr. Kaur is a medical doctor and a public health leader with more than 3 decades of experience in planning, implementing, and monitoring public health policies and programs, comprehensive understanding of non-communicable diseases control programs, including mental health, cancer prevention, tobacco control, and surveillance. We know that tobacco use is a major risk factor for several non-communicable diseases, and definitely one root cause that we need to address to reduce the burden of disease in general in the region. And in the Southeast Asian region in particular, we know that more than a quarter of people over the age of 15 actually are tobacco users. So, Dr. Kaur, the floor is yours. We look forward to hearing from you about how is addressing this major challenge across the region. Thank you.
Thank you so much for this very kind introduction, and a very good evening from Bangkok, because I'm here for a very important meeting of regional meeting of WHO, and thanks to FIP for the opportunity. Next, please. So we all know that WHO Southeast Asia region which is home to almost 26% of the global population, has the highest percentage of tobacco use among all other WHO regions. So we have 33% of the global burden of tobacco users, adult tobacco users, having 411 million tobacco users in the region, 11 countries of the region. We have 11 million adolescent users, that is 13 to 15 years old school-going children. And we also have 77% of the global burden of smokeless tobacco users, that is around 280 million people who are using smokeless tobacco, and they reside in this region. Next, please. Despite having the highest prevalence of tobacco usage at present, the region has seen a sharp decline in the tobacco use prevalence, but it still remains the highest tobacco use prevalence. So although it's a good news that we have witnessed this decline, and the region overall is on track to meet the global target of 30% relative reduction in tobacco use prevalence among adults. So we have to do a lot more, and I'll be covering that in my slides and meeting the objective of today's presentation. Next, please. I already said that we are on track to achieve this target, that is by 2025, 30% reduction in the tobacco use prevalence. Almost we are having 34%. So we have overshot this target, but I said that we still have the highest average tobacco use prevalence rates among adults globally. So there is a lot to do. Next, please. This slide is showing tobacco use prevalence in the region by tobacco products. If we look at the graph, the upper graph, it is showing current tobacco use in percentage among adults. So the blue bars are for smoking and the orange bars are for the smokeless tobacco. So you can see that some countries like Indonesia, Maldives, Myanmar, Timor-Leste, they have high prevalence of smoking. And some countries like Bangladesh, Bhutan, India, Myanmar, they have Nepal and Timor-Leste also for smokeless tobacco use, and also Sri Lanka as per the latest survey, they are showing now smokeless tobacco use more than the smoking, that which was not there previously. So this is the status among the adults. And if we look at the status among the youth, there also we can see that, for smoking and smokeless tobacco use. So, at some places, smoking is high, Bhutan, Indonesia, and Myanmar, we can say Thailand, Timor-Leste, and smokeless tobacco is high in Bhutan again, and Nepal and Timor-Leste. This Maldives is showing a very high bar because they included the areca nut products with this. So that's not the real picture for smokeless tobacco because it includes the pure areca nut also. Next, please. So here, the segregation by sex of tobacco use prevalence. So if we look among adults, the blue bars are for men and the orange bars are for women. So we can say that, it's more prevalent among men, the tobacco use, and compared to women. But then large percentage of women, like almost a quarter in Bangladesh, almost more than 29% in Myanmar, and 14% in India, almost 11% in Maldives. The women are also using the tobacco. And for youth also, if the boys and girls, so the blue bars are for the boys. And we can say that Bhutan, Indonesia, Maldives, Myanmar, Nepal, Thailand, Timor-Leste, they have high prevalence. And then the girls are also using these products. Bhutan, India, Myanmar, Nepal, Thailand, Timor-Leste, and of course, Maldives. They are using these products. Next, please. So for the smokeless tobacco among adults, we have this upper graph, and we have, showing by each countries, and you can see, like I already said, and that is showing the lower graph is showing among the youth, the smokeless tobacco use. So this is the scenario for the region. Next, please. The new challenge which we are now facing for the region is the use of new and emerging nicotine and tobacco products. They are a major threat for the region because they are sneaking in many countries, and especially among the youth. So the countries which have conducted recent rounds of global youth tobacco survey among the children, school-going children aged 13 to 15 years, they have seen that increasingly the children are using these products, they are exposed to these products. And we can say that at least 10 million adults and 3 million adolescent electronic cigarette users across the region, but actual number may be much higher because some of the countries in their surveys, they haven't captured the complete information because Thailand did the recent round of the Global Youth Tobacco Survey, and they found that 17.6% of the school students in this age group, 13 to 15 years, they are currently using electronic cigarettes, and compared to the figure of 11.4% who currently, smoke tobacco. So now the use of the electronic cigarettes, the vaping, it's more than the smoking for Thailand. And we have some countries which ban these products. They have comprehensive bans, DPR Korea, India, Nepal, Sri Lanka, Thailand, Timor-Leste. But then the bans are not that much effective because the use is still there, the access is there, and people are accessing and they are using this. And we have Maldives, they are regulating the, as per their law, they have to regulate these products as tobacco products, but they are not doing much because we had a meeting this morning on the quit lines in the region, and the countries were informing, what is working for cessation. So they informed that, it's not being regulated. Next, please. So in the region, like I said, that we use with multiple tobacco products. So not only for smoking, there are multiple products, but smokeless tobacco, also areca nut products. So for smoking, we have, you know, like smokeless tobacco along with the areca nut. We have various products which are, manufactured, or which are kind of, they make their own, it's custom made, and they become very difficult to regulate. And prevalence of smokeless tobacco is high, and these are low cost products as compared to the cigarettes. And they are socially acceptable, I mean, not like uh, sometimes cigarettes in some countries, but here you find acceptance. And then they are affordable options to cigarettes also. And then people switch from cigarettes to smokeless tobacco, people switch from cigarettes to other smoking products like BDs, and we have Kretex in Indonesia, the club cigarettes, we have Roll Your Owns in Thailand. So all these products, in their multiple forms are available for use, and they cost less. Next, please. So data now we have there, which corroborates the high demand for cessation. So we have high tobacco use prevalence, and we have high demand for quitting the use. So we had like various surveys. I'm quoting here from the Global Youth Tobacco Survey 2022 Thailand, where 8 in 10, almost 77% of students who currently smoke, they try to stop smoking in the past 12 months. And the GATS Bangladesh and GATS India also showed, high percentage of people, current smokers who wanted to stop smoking, and then current smokeless tobacco users who wanted to discontinue this or wanted to quit. And Indonesia also, they did their GATS in 21, and 60 almost 64% of current smokers, they were planning to quit or were thinking about quitting smoking. And for Sri Lanka also, their latest survey says that almost 52% of the current smokers, they were planning. So there's a huge demand, this is a huge proportion of people who want to quit smoking, who want to quit smokeless tobacco use. Next, please. So tobacco cessation is an integral part of the tobacco control policies, overall tobacco control policies, because if we look at Framework Convention on Tobacco Control, WHO FCTC, Article 14 of the WHO FCTC says that demand reduction measures concerning tobacco dependence and cessation. So when we are doing overall tobacco control, then demand for cessation, the quitting, it increases. And O of WHO Empower, which is a package of 6 policies, evidence-based policies to reduce the demand of tobacco. O is offer help to quit. Like M is for monitoring tobacco use and policies. P is protect people from tobacco smoke. O is for offer to quit. Warn the people about dangers of tobacco. That may be through the pictorial health warnings, or it can be through the media campaigns, and enforce ban on tobacco advertising, promotion, and sponsorship, which we call TAPs, and then raise the taxes on tobacco. So if we implement these policies, the demand reduces. And then it's also one of the best bias for tackling NCDs, where we recommend that population level measures for quitting tobacco use should be implemented. Next, please. So how we are performing regarding tobacco cessation, So because we know that quitting tobacco has major and immediate health benefits, so we promote it through all our forums, and we have the evidence-based policies available. So how the region is doing, we'll just see. Next, please. So number of countries in the region with highest level of achievement, which we see during this, we look at Empower measures every 2 years, and a report which is called Global Tobacco Control Report, GTCR, that is published every 2 years. So as per that, there are some parameters. So to get to the highest level, you have to have a national quit line, you have to have both NRT and cessation services cost covered in treatment of tobacco dependence. So from the period, 2009 and till the last report came last year, we have been looking at this because Empower was implemented in 2008. So only one country, since 2017 has been kind of meeting all these parameters, and it is at the highest levels because some countries have the quit line, some countries have not so functional quit lines, some countries don't have the quit lines, some countries have NRT, some don't have. So they are not meeting these parameters. And DPR Korea is one of the only 3 low-income countries in the world which makes cost-covered NRTs available to those who want to quit tobacco. National tobacco cessation strategies encompassing all tobacco products, they ought to be in place in all countries. Because like I said, there are use of multiple products. So when we do tobacco cessation, we need to look at all the products, or not only, smoking or smokeless, or because then it becomes just a part of it. Next, please. So this is from the Global Tobacco Control Report. Like I said, the first one came in 2009 and the last one last year, and the next will come next year. So here we can see only one country is green, which has that quit line and both NRT and some cessation services cost covered. And most countries are blue. That means NRT and some cessation services, at least one of which is cost covered, is available. And Bangladesh is yellow, that is NRT and or some cessation services. So neither is cost covered out of this. And they are trying to establish now a quit line, so they will come higher up in the ladder. And we have Nepal, and they have very basic things, so that doesn't get covered into any of these parameters. So this is the situation. So we can see that the health systems, they have their limitations when the offering this support for tobacco cessation comes into play. Next, please. So again, talking of the capacity, for tobacco cessation. So tobacco cessation support at hospitals and primary care hospitals is available in most countries, but in a very limited manner. And some countries like Nepal, they are doing it, as part of WHO PEN package, that is package of essential NCD care. And then we have toll-free quit lines, like Bhutan. It's kind of not functioning for some time. We have India. We saw they have multiple quit lines. We have Indonesia, Sri Lanka, Thailand. One of the best models in Thailand. We just had a field visit today to look at that. And then Timor-Leste they are planning to establish, although they made some efforts, but it didn't work out. And NRT is legally sold in DPR Korea, India, Indonesia, Maldives, and Thailand. And some countries have it on their essential medicine list. But the cost is a factor, because then repeatedly they were saying that, they want some support for the NRT. Next, please. So most countries, we know that they have very limited capacity for tobacco cessation, in spite of the fact that demand to quit is high. So there is a gap in demand, between demand and supply. And provisioning quality tobacco cessation services at the population level, it holds the key. Because of the high percentage of tobacco use, the high burden of tobacco use, we need to have this population level cessation services to help people who want to quit. And we remain at the WHO Regional Office for Southeast Asia committed to provide technical support and review support to all member states for establishing national quit lines. And also we helped India and Timor-Leste a couple of years back with NRT. That was distributed at the subnational level through the tobacco cessation clinics in both the public and private sector. And that was quite helpful. And in fact, they want to sustain those programs, but then provisioning of NRT remains an issue, because countries have to come forward and meet this cost. Next, please. Brief advice on tobacco cessation. It takes less than 3 minutes, and it consists of 5 A's. Asking if the patient using tobacco in any form, advice on quitting tobacco, assessing readiness to quit tobacco use. That is how motivated the person is. Then assisting with counseling and appropriate treatment and arranging for follow-up. So this is a standard evidence-based method. And the healthcare professionals, the first point of contact, when the patient comes to them, they should ask about the tobacco use, and especially these countries where tobacco use is so high. And tobacco cessation, many countries are integrating, like I said, the brief advice with different health programs, NCD programs, and also the tuberculosis, because some countries, they are high burden for both tobacco use and TB. So India, Nepal, Timor-Leste. So here, we see the role of the, pharmacist also, because that becomes the key. Because when we give the DOTS treatment, when these patients, they kind of access the treatment, that becomes a point of contact to provide them more help. And we did this pilot in India, and we have published some documents also to support countries to uh, kind of undertake this integrated TB tobacco program and promote cessation. Next, please. Like I said, we had a national joint framework now for India. We had original document in 2017, but the progress is very slow. And that is why I'm looking at the role of pharmacists, which can be played here, because having this integrated programs and helping these TB patients who are tobacco users. So that may be smoking, that may be smokeless tobacco. So that becomes the key, And then at the end of the treatment, you can just see, because you have 6 months and of DOTS. So we had a very high success rate, almost 60% of quit rate when we did the pilot. But unfortunately, this was not kind of sustained at the country level. India is doing some program because they have very good TB program and a national-wide tobacco program. But then we need more of efforts and sustainability. Next, please. So we have a WHO Quit Tobacco app also, and that is available both for Android and iPhones, and for the people to download the app, and this helps in quitting tobacco use. So that is one of the important tools. Next, please. So the way forward is that every country should strive to have a functional national tobacco quit line to meet the growing demand among smokers and smokeless tobacco users for greater public health gains. It's important to explore the possibility of having integrated quit lines, because today we had discussion to have an integrated quit line for tobacco, alcohol, substance use, so that providing comprehensive solutions to addiction and multidisciplinary approach is imperative. The pharmacist can play a vital role in context of brief advice and functional quit lines. And I think also where NRT is available over the counter, for example, in India, the 2 mg is over the counter. So that time also, we can provide the because few minutes brief advice. So I think that is an important avenue. And best practices regarding national quit lines and scope of establishing and expanding integrated quit line needs to be shared. And here Thailand is the torch bearer. And challenges of including smokeless tobacco cessation and e-cigarette cessation also, that needs to be addressed, because now, like Thailand shared, that people who are vaping, using electronic cigarettes, they are also coming, they want to discontinue the use. Possibilities to integrate quit line, and we have a mobile cessation program, for tobacco, and India is implementing that, and they are now trying to integrate that for the better outreach, and so that delivery quality tobacco cessation services at the subnational level, that can be taken up. So these are, some of the examples, some of the things which countries are doing, which they can build upon, which they can strengthen, depending upon the capacity of their health systems, and how we can have help of the pharmacist and various programs at various levels. We'll discuss that also. If we'll take some questions and we can see, but next, please. I think that is my last slide. Yeah. So thanks for your kind attention, and that's all from my side. Thank you.
Thank you so much, Dr. Kaur, for this very engaging and very interesting and comprehensive presentation. Indeed, I noted that you mentioned that there is a gap between the demand in terms of people wishing to quit and the availability of services to support people in tobacco cessation efforts. And I think that, as you mentioned and highlighted in your presentation, pharmacists do have a role to play in increasing that supply of services to support tobacco cessation. So this event is precisely to showcase some of the ways in which pharmacists are doing that precisely, and to encourage other organizations, other pharmacist organizations and individual pharmacists to implement these services in their practice across the region. So we'll hear from 3 countries now, and the first one, I would invite Dr. Vindhya Pathiraja from Sri Lanka to present on how pharmacists in Sri Lanka are providing these services. Dr. Pathiraja is a senior lecturer in pharmacy at the Department of Pharmacy Faculty of Allied Health Sciences at the University of Ruhuna, Sri Lanka, and she obtained her Bachelor of Pharmacy special degree and also a Master of Philosophy in Clinical Pharmacology from the University of Perdenia in Sri Lanka. And currently she's a professor of areas including pharmacology, toxicology, clinical pharmacy, pharmacotherapeutics, biopharmaceutics, and pharmaceuticals. She's also a member of the Council of the Pharmaceutical Society of Sri Lanka and a counselor at the Commonwealth Pharmacists Association. Dr. Pathiraja, it is a pleasure to have you with us at this event. The floor is yours for your presentation. Thank you very much.
Thank you very much for the nice introduction. So actually, I'm really glad to be here as a speaker representing Sri Lanka. And I think Dr. Jagdish, the previous speaker, has made my task easy because she was like comparing the status of our country as well. So I think my duty will be a little easy in summarizing the status of Sri Lanka now. So yeah, starting the speak, I just want to highlight that I'm talking about the status, trends, impact, policy context, policies, barriers, and the pharmacist involvement and the way forward during my presentation. So next slide, please. Yeah. So as we all know, smoking is a dangerous epidemic, claiming more than 8 million lives each year globally. So out of which nearly 1.2 million victims are non-smokers. That is the dangerous thing here. So as highlighted by the latest WHO global report on trending the prevalence of tobacco use, so the number of annual deaths is expected to keep growing even after rates of tobacco use start to decline. So because tobacco-related diseases take time to show symptoms, that might be the reason behind this. Even the rates are declining, the number of disease rates are increasing. According to the National Authority on Tobacco and Alcohol in our country, currently over 1.5 million Sri Lankans smoke as much as 1.1 million cigarettes daily. So this high number of current male, smokers who are 15 years and above amounting to 20% is concerning given the high death, social, environmental, and economic cost incurred by the country due to tobacco. So for instances, if I can remember the data correctly, in 2015, Sri Lanka incurred a cost of 89 billion cost owing to both direct and indirect costs for tobacco. So of this, the cancers and other non-communicable diseases caused by tobacco play a major role. So every year, more than 12,000 Sri Lankans die due to tobacco-related diseases. Raising raising about this issue. So the government, they have committed to control the tobacco prevalence in the country. And even though they have taken, the government, they have taken several measures to control the tobacco use, the disease burden is still increasing. So the next slide, please. So you can see the current status of the tobacco use in another graph, addition to the first graph. Next slide. Yeah, here also in this graph, it clearly shows even though there's a reduction in the prevalence of the use of tobacco. So as I told you, the disease prevalence is still increasing. Next slide, please. Yeah, here this slide shows the words of one of the patients who involved in one of the studies conducted in Sri Lanka. And it says how these people, they believe and behave after diagnosing with cancer after several use of tobacco for several years. Next slide, please. Yeah, here in this slide, you can see how the people, they have the trend in, declining the use, even though, the numbers are becoming very low across, the country, even though the government, they have taken the measures in banning smoking in public places, banning the sales and promotion of tobacco for youth under 21 years of age, the banning of tobacco advertising, promotions, and the sponsorships. So only this much of a level is declined after several years of attempts. Next slide, please. Yeah, here this slide shows the impact, the current impact of Sri Lankans in using tobacco. So when it comes to the deaths, the WHO, it estimates the deaths occurred and caused annually in Sri Lanka due to smoking as 10% of all the deaths. It's a considerable amount when it comes to the number of all the deaths in our country. And also there's a great risk with the NCDs, non-communicable diseases, as I told you before as well. And it puts a huge burden on the economy. So when it comes to the economy, so across income groups, the smokers are more likely to come from households in the lowest wealth, across occupational categories, skilled agricultural and fishery workers and craft and related workers record high prevalence rates. And when it comes to the impact, it adversely impact on the environment. And also it hurts the individual's relationship with family and friends. And it adds an additional pressure on the country's health system because of the health cost which incurred. Next slide, please. Yeah. So here you can see the graph, and as I told you, the people who are having a low income level. So from the poorest 20% households, you can see how they spend money for the housing, rent, and energy. The tobacco users and not tobacco non-users. So when it comes to health, it's also the same. And when it comes to the education, it's the same. Next slide, please. Yeah, when it comes to the economical burden, so for the studies, according to the studies, we understand if we reduce tobacco consumption by 20%, so there will be a 30% of net benefit to the economy. Next slide, please. Yeah. So when it comes to the policy context, at the moment, Sri Lanka becomes a party to the WHO FCTZ 2005, and we do have a national authority on tobacco and alcohol, and we have an act under that, Act number 1, number 27, 2016. So where this act incurred the law of the governing tobacco control in Sri Lanka. So this act controls all the places where we can protect the humans from the tobacco use by restricting the smoking in public places, packaging and labeling requirements, tobacco advertising, promotion and sponsorship, establishment of the National Authority on Tobacco and Alcohol, and offences and penalties. So when it comes to the sales and the marketing of tobacco, now according to the National Authority on Tobacco and Alcohol, they have to show these pictorial diagrams where it shows the cancers and all the disease conditions which impact badly on people's health. So addition to that, we have a sales restriction. So the people who are below 21 age in our country, they can't purchase cigarettes. So after 2015, these graphical warnings on product packaging is a compulsory thing for the sales of tobacco. And by 2016, we have these regulations on smokeless tobacco products and e-cigarettes. Just like the previous speaker mentioned, we do have a trend in using e-cigarettes and smokeless tobacco products in our country recently. Next slide, please. And what are the challenges and barriers? So when it comes to a developing country like Sri Lanka, we do have a lot of barriers in preventing the use of tobacco because of the industry interference. As we all know, these tobacco is backed up by a lot of multi-million companies, and so those industry interference is there involving in a very bad way. And we do have some gaps in the existing policies and laws where the people can go through these loopholes and break the rules. And also in our country, we do have these implementation gaps in implementing the rules for these tobacco users. And when it comes to anything and everything in our country, the political influence is there, and it's same for the tobacco as well, because it gives a lot of income for the companies and the industries where they involve in producing and selling these things. So and addition to that, there's a misconception on income generated by tobacco. And we do not have a strong public movement on this, even though I'm representing the pharmacists in our country. So at the moment, we don't have a strong public movement, even with the professionals, I mean the pharmacists. So no strong public movement from the general population. And the stakeholders, they are not having a strong connection with key decision makers. So those are the main challenges and barriers for cessation of tobacco in our country. Next slide, please. Yeah. So the pharmacist involvement. So even though this session is basically to highlight the involvement in the pharmacist in cessation of tobacco. So in our country, Sri Lanka, we the pharmacists, we are not much involved in these cessation programs. Even though we are conducting individual research projects, different research projects are conducted by the policy making institutions and the universities and the other research institutions to come up with the stats and all these evidence about the disease burden and the diseases associated with tobacco use, especially as pharmacists, we don't have a strong movement or strong interference to prevent the cessation to prevent the use of tobacco or to cessation of the tobacco. So, however, there remains a noticeable gap in the involvement of pharmacy in raising awareness and taking concrete steps toward tobacco control. Because when it comes to our country, basically these tobaccos are available in each and every shop where they can go and buy. And when it comes to the pharmacies, they don't directly get in contact with these customers, and we hardly get these patients after they get some kind of a disease, and we don't bother in counseling or doing some additional work when they come to the pharmacy or in the hospital or PD or clinic. So that is the real situation at the moment in our country. So we do need to have some kind of a step forward thing to involve in the cessation of tobacco. So next slide, please. Yeah, so when it comes to the policy changes, so when it comes to the Sri Lanka, we do have an attempt called Last Mile Smokers, where they study about the impact of different interventions, and we target the awareness increase in existing support service, and when it comes to tobacco taxations. So recently government has increased the taxation for these tobacco containing products, and even with the taxation, the people, they are keep on using the tobacco products just like earlier. And when it comes to the numbers, when it comes to 2023, so it increased the government revenues by 37 billion Sri Lankan rupees because of the taxation. And next slide, please. yeah, when it comes to the policy changes, addition to the taxation, we have a ban on selling single sticks. So if the people they want to buy cigarette, they have to purchase a pack. So there's a ban on selling single sticks, and 81% of smokers are purchasing cigarettes as single sticks. So sales of single stick cigarettes encourages smoking initiation. So there's a good impact if we ban this selling of the single sticks. And when it comes to smoking cessation, a huge unmet demand, especially from LMS, and it talks about the introduction and implement target behavioral cessations. So as pharmacists, we do have a big role here in our country to come forward and act accordingly to support these policy changes and act in a vigilant way to increase the cessation of tobacco. I think that's my last slide. Yeah, this one. So the way forward, yeah, previous slide, please. So as the way forward, so we need to have continuous collective pressure on the government, even though we do have some kind of acts and laws implemented. We need to have an awareness, advocacy, and empowerment to increase the collective pressure to the government. And it will increase the awareness of the society, and we will be able to decrease the prevalence of tobacco use, and at the same time to decrease the prevalence of tobacco-related non-communicable diseases. So thank you very much, and thank you very much for giving me the opportunity.
Thank you very much, Professor Pathiraja, for your excellent presentation. And we will move on now, for the sake of time, with Dr. Tongrod's presentation. Dr. Virat Tongod is a lecturer at the Faculty of Pharmaceutical Sciences at WashU. Wow, this is a challenging name for me. Chalermprakyat University in Thailand. Apologies for my mispronunciation. He's also an advisor of the Pharmaceutical Association of Thailand under royal patronage, which is a member organization of FIP, and also a community pharmacist and manager. So he'll be speaking both as from an academic perspective, but also based on his experience as a community pharmacist. So thank you very much, Dr. Tongod. The floor is yours, and I appreciate that speakers try to keep to the allotted time so that we have some time at the end for questions. Thank you very much.
Yes, sir. Thank you. Thank you for good introduction for me. Good afternoon from Thailand. As the first speaker said that high demand for smoking cessation, I would like to add that pharmacists can help. My outline are as follows. The first is a Thai situation on tobacco, and then the flower or the initiator or the starter of the action, the foundation of community pharmacy. And third is our support for pharmacists from this foundation, like training, education, support. And the fourth is the role of the pharmacist in tobacco control. Then success story lead by pharmacists. And the last is innovation in tobacco cessation. Next slide, please. About 20% of Thai people are smokers, and the majority in men. Next slide, please. About 70,000 of Thai die from smoking each year, and it costs nearly 200 million baht per year. Next slide. The starter or the founder of this smoking service in pharmacy profession is the Dr. Kata Bandit Tanukul since 2009 or 15 years ago. He worked as a chairperson of the Community Pharmacy Foundation. They set a pharmacist network for tobacco control, which raised funds or budget support from Thai Health Promotion Foundation. Thai Health Promotion Foundation is raise money from the syntax. Next slide, please. This network includes pharmacists from community, hospital, and academic. He established smoking cessation clinic and hotline to promote service. Next slide, please. And we also have like a short course training for quit smoking. It may be half a day or the whole day. Next slide, please. This is the short course training for half a day for quit smoking. Next slide. And we also have like a long-term training. It takes about 4 months. Training for specialists in smoking cessation. Next slide. The foundation supports pharmacy professionals for smoking. This slide shows like media, brochure, leaflets, carbon monoxide meter, peak flow meter, nicotine gum, and some medicine for smoking cessation. Next slide, please. And this one is a infographic that pharmacy or community pharmacy can download and promote and use it for smoke cessation campaign. Next slide, please. And this one is a clip video that for quit smoke cessation. Next slide. And also the role of pharmacists in tobacco cessation. We promote the role of pharmacists in tobacco. This one is shown like a social event in the department store or like in the downtown. Next slide, please. And we distribute our promotion material to the community pharmacy and hospital pharmacy to promote or campaign quit smoking like this picture. And next slide, please. And this one, we also have like a pharmacy student to join our campaign for the community. Next slide, please. And this one, we have campaign. Next slide, please. Up to now, we have like a network of pharmacy, about 250 community pharmacy in our network that service smoke cessation in the community. Next slide, please. We also use 5A approach or 5A strategy to quit smoking like the other country. Ask, advise, access, assist, and orange. Next slide, please. This is my flow chart, our flow chart to run 5A. Next slide, please. This research article was published in 2021. It's about the smoking cessation services by community pharmacists, the real world practice in Thailand. Next slide, please. In this study, the majority is the male and the female is the minority. And the motivation to quit is from the first is a health concern and the second is the family concern. Next slide. And the state of change is a majority in preparation, follow is contemplation, and we use medication about 2/3 for health smoker quit smoking. Next slide. The outcome of the research, we found that about 28% of the smoker can quit smoking more than 30 days. And the number of cigarettes smoked daily reduced from 15 to 0. The level of exhaled carbon monoxide in ppm reduced from 11 to 6, and the percentage of peak expiratory flow charts increased from 86 to 89. Next slide, please. We can conclude that quit smoking rate is success in Thailand about 30% and can reduce the number of cigarettes smoked each day and also reduce the exhaled carbon monoxide level and increase the percentage of the PEFR. Next slide, please. The second article is published in 2020. The effect and cost of smoking cessation service provided by community pharmacists in Thailand. A descriptive study approach. Next slide, please. It also, this slide shows the continuous abstinence rate, about 33% at the week 12 and 20% at the week 24. The number of cigarettes per day reduced from 10 to 1. And the mean percentage of PEFR increased from 87.5 to 93.6. And pulmonary carbon monoxide reduced from 9 to 4. Next slide, please. And from this paper, we found that the average cost per participant or per smoker that joined this project was 506 baht. It's about $17. And the average cost per success quit was 2,531 baht, or about $84 at week 24. In conclusion, this study indicates that smoking cessation service from community pharmacists is effective at low cost. It could promote continuous smoking cessation at week 12 and week 24 after the initiation of smoke cessation. Next slide, please. For pharmacists that did quit smoking, we payment for them about 150 baht or about $5 if they service from A1 to A4 is the Form 5A strategy. And we reimburse pay for community pharmacy 100 baht or about $3 for A4F. And add on 550 baht or about $1.5 for A5. This is reimbursed for pharmacists that give the service to the smoker. Next slide. And this one show the network of our pharmacist professional to control tobacco. We promote our network in the community and the school. Next slide, please. And also we promote it in the temple for the monk or in the village, in the community to raise them awareness. Next slide. Next. For better tobacco control, we initiate proactive search and screening, not only on-site service only. Our team go to the village, go to each house to find the smoker and invite them to join our service. Next slide, please. And we set the service in the rural area, in the remote area. And we also use telephone for our smoking cessation service for the rural area. Next slide, please. And also we use telepharmacy for smoking cessation. Next slide, please. We also set research and develop on Thai herbal. Its name Little Iron Weed or Velonia cinerea. And for health hour smoking cessation. Next slide, please. In Thailand, e-cigarette is a illegal. Pharmacists and have take action on this with the police. Police with pharmacists go to the shop to arrest e-cigarette shop. It's also used a lot in the youth or young adults because they have like many like a cartoon for the young adults. Next slide, please. We must to promote. For the final, we would like to say we need food, not tobacco. Thank you for your attention.
Thank you very much, Professor Tongrao, for this amazing presentation. We are impressed with all the work that Thai pharmacists are doing in reaching out, in supporting tobacco cessation. It's really impressive to see the range of activities and services that are provided. Thank you very much. We are running a little bit behind schedule, so I will invite Audrey to give her presentation now, and then Ines. I'm not sure we will have time for questions, but do keep them coming and we will address your questions to the speakers after the event. And our next speaker, Ms. Audrey Clarissa, is Vice Secretary General at the Ikatan Apotheker Indonesia, the Pharmacists Association of Indonesia, which is also a member organization of FIP. Audrey is also the Vice Chair of Business Development at GP Pharmacy Indonesia and holds other leadership positions. She's also a former president of the International Pharmaceutical Students Federation and has been a close collaborator of FIP for many years. Audrey, it is a pleasure to have you with us today to describe the efforts that have been taken in Indonesia in terms of engaging pharmacists in tobacco cessation services. Thank you very much. The floor is yours.
Thank you, Venkata, for the introduction. Good evening, everyone. I think it's a great opportunity to be able to share about what happened in Indonesia, and I'm very glad to hear what has happened in other countries, as well as the estimation, the data from WHO about the situation in Southeast Asia region. Well, as mentioned in the first early slides of our speaker from WHO, Indonesia is one of the largest tobacco users. And not only that, it's because we are also one of the largest tobacco producers in the world. And Indonesia is very known for its high quality. So in this sense, it's a challenge for us because it has a political and also economical value of tobacco in Indonesia. And most of the tobacco in Indonesia is basically coming from the local farmers. So it's very important for many Indonesian families. 99.6% is coming from them, while it's only 0.4% coming from big corporations. So actually, it contributed for more than 10% of national budget. The tax coming from the tobacco is very high, and it is used for a lot of expenses in Indonesia. And it also provides a lot of jobs. That's why Indonesia is quite hesitant to sign the WHO FCTC. There's understanding, and also the government is well aware that tobacco is a risk for health, especially now we have the largest universal health coverage in the world, BPJS, through the JKN. But then at the same time, it also provides a lot of funding to Indonesia. That's why it's quite a big challenge for Indonesia. Next slide, please. However, just last year, we have a new law in Indonesia. It's a health law that it takes all healthcare laws into one policy. It's the law is in the chapter 149 until 152 specifically discuss about addictive substances, especially tobacco. So this is the first time there is a law in Indonesia that manage and make a rule about tobacco for health issues. So last year was a big progress for Indonesia. And in that law, it mentions tobacco and all tobacco products. So everything that is related to tobacco is controlled, including the electric tobacco. And that way, pharmacists are very expected to play a higher role, especially in the BPOM, the Indonesian FDA, where most of the Indonesian FDA is pharmacists, and also the pharmacists in the pharmacy practice. So we are hoping that a lot of actions will be taken by pharmacists to help for the tobacco cessation. At the moment, it is really hard for the Indonesian people to stop smoking because it has been a culture. It has everybody is used to it, and sometimes people are when you want to stop, and the environment is not supportive of that, especially because many people are very dependent on the tobacco industry and the tobacco economy as well. So that's why one of the things that was discussed, including with the pulmonologists, about considering to take an opportunity of conduct clinical trials to see the differences between conventional tobacco and electric tobacco. Because at the moment, Indonesia is very well known for the kretek. So it's a special type of tobacco in Indonesia. So that's why Indonesian people cannot usually move to any other type of tobacco. There are many various types of tobacco, but the one that is used a lot is the kretek. And the electric tobacco used in Indonesia is very small. Nobody likes it. And all the products the nicotine replacement therapy, even though it's available in Indonesia, nobody is using it. Pulmonologists, doctors can prescribe, but still nobody is taking the product. And that's why it's a big challenge. That's why we see how to reduce the cost, because using tobacco is also a big challenge for us in the universal health coverage. Next slide, please. The condition is like that, from us, for the Ikatan Apoteker Indonesia, for the Indonesian Pharmacists Association, we still try to do several campaigns during the World No Tobacco Day. We cannot really make a big campaign, so at the moment we are still increasing the awareness that tobacco is dangerous. Well, everybody knows, but we just need to remind. Of course, we cannot make it really big because tobacco itself is giving a lot of income for Indonesia. But however, pharmacists in Indonesia have been well aware, and we are trying to increase more awareness among the pharmacists, and also so they can be more actively involved in the tobacco replacement therapy, understand very well what is the nicotine replacement therapy, what are the available treatments. That's the awareness that we are trying to raise. Some pharmacists who have an interest in the tobacco cessation, they are doing it personally. We cannot really do it massively because it's not very well supported by a lot of people. So that's why I think it's very important for us how to switch the economic situations, and also to increase the awareness of the health issues in Indonesia. So that's why we hope that by the new law, the new awareness, then many things will happen, especially now. We are working very closely with the PDPI, the Pulmonologist Association in Indonesia, for tackling this issue, because we have plenty of COPD patients, we have plenty of asthma patients, and many cases tuberculosis as well. We are the second highest in the world. So that's why tobacco issue is a very big concern for us. So we hope that we can learn from what you have done in your countries, and as well as also doing more proactively, as the government will support more how we conduct the tobacco cessations, and also increasing the awareness between the healthcare professionals. Thank you very much, and I hope this can give you a more insight about what happened in Indonesia and what we are trying to do. We are a bit behind, but at the same time, we are hoping that we can do something step by step. Thank you very much.
Thank you very much, Audrey, for this concise but very informative presentation. We really appreciate it. And indeed, I mean, we understand the challenges that, of course, when 10% of the national income comes from tobacco harvesting, and it is challenging from a political point of view to support tobacco cessation. But indeed, we see that pharmacists are stepping up and participating and supporting people who wish to quit to do so. So thank you very much, and of course we are best encouragements to Indonesian colleagues who take up the challenge of offering tobacco cessation services. Thank you, and I now have the pleasure of giving the floor to our last speaker today, Dr. Inês Nunes da Cunha. Inês is the Practice Development and Transformation Projects Manager at FIP. And she has, before joining FIP, she worked at a community pharmacy, as a community pharmacist for 14 years, and she also has a PhD from Granada University. And it is my great pleasure. Inês has also led a lot of our work on tobacco cessation and respiratory diseases and NCDs management. So she does have a great deal of expertise in this area, and particularly she authored the handbook on tobacco cessation services for pharmacists, and that you can find online on our website, and also the more recent intelligence report on tobacco cessation, pharmacist-led tobacco cessation services, which was launched just a few weeks ago on the 31st of May, World No Tobacco Day. So Inês, thank you very much, and it is my pleasure to give you the floor for the final presentation. Thank you.
Thank you very much, Gonçalo, and thank you to all the colleagues who presented great examples of pharmacist-led tobacco cessation services in their countries. I think it is really inspiring to hear these different examples and to learn with these colleagues from different countries. It is a great pleasure for me to share with you today the work FIP has been doing in this field and what pharmacists can do to help individuals to stop using tobacco. FIP has been working for several years in the field of non-communicable diseases and in particular tobacco cessation as part of our commitment to the WHO Astana Declaration on Primary Health Care signed in 2010. One of the ways FIP has been doing this is through the FIP Practice Transformation Program on Non-Communicable Diseases. This program aims to provide tools and strategic support to FIP member organizations to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and treatment optimizations of non-communicable diseases for improved patient outcomes and health systems efficiency and sustainability. The program initial focus on these 5 diseases that you can see on the slide: cancer, chronic respiratory diseases, diabetes, mental health, I think diabetes and chronic respiratory diseases. But we also, for us, it is also important to address risk factors for NCDs, such as tobacco use, because tobacco use is a risk factor that can affect and also trigger all these diseases, but in particular chronic respiratory diseases, cancer, and cardiovascular diseases. So in addition to developing resources such as handbooks and knowledge and skills guides for pharmacists in each of these 5 disease areas, which are available on our microsite, like my colleague Gonçalo said before, we also developed specific resources focusing on pharmacist-led tobacco cessation services. This includes the handbook you can see on the left of the screen, Handbook for Pharmacists Supporting Tobacco Cessation and Tobacco Dependence Treatment, which was launched last year on World No Tobacco Day, and also the FIP Knowledge and Skills Guides, which describes the knowledge and skills pharmacists need to provide effective tobacco cessation services. These resources are also available in Chinese, French, Spanish, Turkish, and we will soon have translations of this available in Arabic. Also, last year, FIP launched a holding statement on the use of electronic cigarettes. We know that electronic cigarettes are becoming more and more popular, especially among younger adults and also teenagers, due to the flavors and strategies to make them very appealing, and also to a certain misperception of these products as being harmless to health, which is really not the case. So FIP has published this holding statement to inform about our position on the use of these products. FIP also started to work at country level to support our member organizations, particularly in Jordan and India. We have started to support these 2 countries because they have a higher prevalence of tobacco use. And Jordan in particular is one of the 6 countries in the world where prevalence of tobacco use was actually increased. We have started with these 2 countries, but we will probably support our member organizations in other countries as well. This year, on the World No Tobacco Day, as my colleague already mentioned, we have published a joint declaration, a joint statement with the WHO on the role of pharmacists in tobacco cessation. This statement describes a number of ways in which tobacco control programs and pharmacy associations can work together towards the aim of develop and implement plans to engage more pharmacists in the advancing tobacco cessation. During the webinar where we present this joint statement, Dr. Vinayak, head of the WHO No Tobacco Unit, said that the statement calls for a collaborative effort among healthcare professionals. Specifically, it advocates national action to empower all pharmacists to routinely provide tobacco cessation support. And Dr. Prasad added that if every pharmacist identifies and advises just one tobacco user to quit each day, this collective action could reach over 4 million users in a single day. At the webinar, FIP also launched the Global Intelligence Report on pharmacist-led tobacco cessation services. The full version of this report is only available to FIP members, but the pharmacist-led tobacco cessation services evidence of impact and country highlight version is available on open access. You can also have open access to the FIP Global Tobacco Cessation Survey findings. Through June and July, we will be running a series of digital events focused on empowering pharmacists to support tobacco cessation, and today it is the second of 6 events. We are also be working on a FIP statement of policy on the role of pharmacists in establishing a future free from tobacco and nicotine dependence to be adopted by the FIP Council in Cape Town in September this year. In conclusion, the negative effects of tobacco use on health are well documented. However, giving up tobacco and quitting can be a challenging process, but the journey towards a tobacco-free life can be made easier with the right support. And we, pharmacists, have an important role to play in helping tobacco users quit and remain abstinent. Pharmacists' expertise and accessibility ensure we are ideal providers of evidence-based advice, medication, and support to those who want to break their addiction to and dependence on tobacco. All of the program publications, events recording, and other resources and tools are available on our microsite on NCDs at ncd.fip.org. Any questions, comments, suggestions are very welcome, and please send us an email to ncd@fip.org. Thank you very much for listening. Back to you, Gonçalo.
Thank you so much, Ines. Great presentation. And as you can see, colleagues, there's a number of resources that can both support the policy work of our member organizations, pharmacist associations at country level, but also the individual work of pharmacy practitioners in providing tobacco cessation interventions and services. So we do invite you to visit our microsite and check those resources that can support you in your practice and in your organization. Unfortunately, we do not have time to address any questions as we would have wished for and to enjoy a panel discussion with our speakers today. But I'm sure that all of you will agree that the presentations have been very informative and very comprehensive. So a big thank you to all our speakers for sharing your expertise with us today and for sharing these examples of how pharmacists are contributing to tobacco cessation strategies at country level. Dr. Kaur, as you may have seen, Ines has mentioned that FIP is collaborating with the Indian Pharmacists Association in developing tobacco cessation services through community pharmacists in India. And I'm sure that our colleagues at IPA will be reaching out to you to collaborate with the WHO and join efforts in this common challenge and shared goal. Again, thank you all very much. And as you can see, there's a lot that pharmacists can do in this area of tobacco cessation. We do invite you to check our events website at events.fip.org. And also, if you haven't yet become aware or familiar with our upcoming Congress, to check also the FIP Congress website at Cape Town 2024 at fip.org. The Congress will be taking place in the first week of September, and we do invite you to join us there if you can, and to learn from innovations in practice from all around the world. So again, thank you all very much for attending. Thank you to our speakers, and we wish you a good evening or a good rest of your day. Goodbye.
Thank you. Bye-bye.